the AAMC and the GIR committee for this award. When I expressed to people in our teams, that we had secured this award, that it was given to us, they were incredulous. And part of the reason they were incredulous is they felt that they were just doing their job. And I don't think that they realize that the SQL administrator doesn't realize the impact of the work that they do. So to be awarded for some work that they've done makes them feel like they have impact. It manifests that impact for them. And so on behalf of the whole team, I want to express my thanks. I think LifeScale is both a labor of love and a labor of passion. As a researcher myself, it is the question of what is the world that I want, and making sure that I represent the research community in advancing the enterprise capabilities that allow us to build the world that we want. What is unique about LifeScale is it is not a research product. It is an enterprise product. Operations uses it, education uses it, research uses it. We all depend on this infrastructure now to advance discovery. I have a picture, and I showed it in my presentation yesterday. One day I took a picture of a Zoom call. You can only have 49 pictures on the screen at once in I think it was Zoom. And then there was a list on the side of everybody else who was in the call. Our calls varied from 18 people to sometimes as many as 80. Because we would have to bring in people from legal, people from compliance, because we were doing things that people didn't really understand. And you had to bring this to them at their level, where they felt secure that they could be part of building this. And so while 40 people built it, it was a labor of love across the community to make happen. I'll also say it was interesting to make this, if you've never had to be in a meeting between lawyers from 2 different organizations for 9 months, good on you. Because I think it is the 7th layer of hell. And I like both the lawyers. They're great people. Everyone's trying to do the right thing. But sometimes the minutia of those conversations, creating a data use agreement between 2 organizations is incredibly detail-oriented and incredibly difficult. But interestingly enough, it has now become the template that we are using to onboard other organizations. And so the future isn't just NCH and OSU. We're going to be ingressing other partners into this environment, including Mercy Bon Secours and potentially Ohio Health, where we'll be partnering with commercial organizations, not just academic medical centers, to create a data source that researchers can use for this purpose. And so we're incredibly blessed to have spent all this time and energy to make a greater good than we could have if we had just done this on the back of a research project, which is oftentimes what we're asked to do, right? Someone gets funded for a project to build something, we build that thing. And at OSU, we talk about investments in the greater good. This is an example of how we spend resources, time, talent, treasure, to advance the greater good. And in my mind, infrastructure is the greater good. It is the backbone of the greater good. And we are all here because that infrastructure is what we take our time to spend, to improve, to lift up. There's a lot of conversation about AI. And I'm just going to spend a moment. One of the reasons why we built this was to enable AI workloads. And in fact, now we're working towards multimodal AI capabilities in the context of LifeScale. But AI requires data. And I am constantly barraged by third parties who are promising me things in order to get access to our data. We as a community are the richest people in AI. And what I mean by that is we hold so much data, and everybody wants it because they want to build off of everyone's work. In LifeScale, we actually have a rule that says if more than 10% of your study in LifeScale touches a single clinician, You have to go ask that clinician to be part of the research team. We had concerns about researchers just coming in and using that data generated through a clinical process without benefiting the entire mission. And as academic medical centers, our clinicians have obligations to publication. And so we wanted them to be included by design. Thinking about these kinds of things, how do we include people by design, is a critically important process as we move forward. But even in the presence of all of this information, I think one of the fundamental shifts that is happening is the move away from computer scientists controlling AI to commodity AI. AI being available for all kinds of uses. And you just, go to any conference now and everyone's talking about AI. And there's a lot of boogeymen. There's a lot of, it's going to change the world. There's a lot of, people are going to lose their jobs. There's a lot of, people are going to find new jobs. I think we are in that transition state between where we were and where we're going to be. And as academic medical center leaders, it's on us to chart a path forward for the rest of the sector, for the rest of the healthcare sector, for education. We are exceptionally resourced. When I tell my colleagues about, in social work or in theater about how AI is transforming things in healthcare, their answer is, well, I don't have that kind of resource. I don't get that kind of money. And my answer is, well, then here, come and partner with us so I can expose you to AI in ways that you wouldn't be exposed to before. And this is a case of where, as we are building these tools, we have to think beyond our medical mission. We have to think to the greater good. And that greater good could be to lift up the arts and sciences. It can be to lift up mathematics and engineering. It can be to help people transition to becoming more competent in a new world where AI is prevalent, but AI doesn't decide things for us. I think we're moving from cutting-edge AI to value extraction from AI. I think we're moving from computer science to IT infrastructure. I think we're moving from how, which was the focus of where we were, to what. Like, what can we learn from these things? And I'll close on this last piece, which is, before I took this job, I'm not going to say all the titles. Before I took this job, I used to have this saying that I wanted to change the world at Ohio State. As a faculty member, I wanted to make a difference. And then I realized that I could change the world from Ohio State. I could do this work, publish the blueprints for this work, and I could make it available to everyone. And I will say, I was stunned when Nature came to me and asked me to interview me about AI. I told them what we were doing. I was supposed to have a 30-minute interview. It ended up being 90 minutes. And they said, would you write an article detailing all this? And I said, sure, because when Nature asks you these things, you don't say no. And I said, sure. I wrote the article. It was 10,000 words because I wanted to put everything in it, right? I wanted to put the protocols in it. I wanted to put, like, this thing is like 100 pages long right now, but the article is 10,000 words. I went to my next conference, and the editor was there, and I had sent the article to the editor, and the editor was like, I read the article, we'll take all the words, because what you've done is just it's just changing, right? It is change. And now I just have to correct all the mistakes. So I'm hoping to be able to share that with the community, to give everyone blueprints to copy what we've done, or to augment what we've done and take it even further. Because everyone is so creative in this room, that ability to take it further is gonna open up new opportunities. For us, the big thing is I'm currently de-identifying all of our 200 million clinical notes. And we're going to put that into LifeScale. We're currently figuring out how to do imaging in LifeScale so that I can do multimodal AI in cardiovascular care as an example. Those kinds of things are where we are. And so thank you for honoring us, and words don't express, but thank you very much.